And you know, almost everyone knows someone that's been impacted by cancer, and National Breast Cancer Awareness Month starts on Monday. And joining me now to talk about prevention and treatment is the director of the Ochsner Tansey Breast Center, Dr. Ralph Corsetti. Thank you so much for coming in this morning.
Thank you for having me here.
I was asking you earlier, are you seeing things leveling off, or are you seeing, what are you seeing overall locally?
Locally, we're seeing a slight increase in breast cancer, and that would go along with the national trends as the population ages, as the population grows, as more and more women are in tune and aware with breast cancer screening guidelines. We certainly are catching breast cancers much earlier, where now 90% of women will survive at least 5 years with breast cancer, and 75 to 80% of all women with breast cancer will be ultimately fully cured of their breast cancer.
And is it mostly, because people tend to think, oh, it must be genetic. Where do you find that lies? Is it most of your patients it's genetically related or something else?
No, it's actually the opposite. Most breast cancers are sporadic or not genetically linked. It's estimated that about 10% of breast cancers are genetically linked. And we use certain guidelines to help screen for potential genetic testing in patients that develop breast cancers at an early age. Certainly if they develop breast cancer at an early age when they're premenopausal, that may be a potential indicator that it may be genetically linked. Some of the different types of breast cancers, like something we call a triple negative breast cancer, may be genetically linked based on the hormones that it produces.
Wow.
And certainly family history. If there's a trend in family history with multiple relatives, particularly at an early age, that's another tip-off that it might be genetically linked.
And some of the things you can do to reduce, I mean, getting checked obviously is important.
Yeah, we typically recommend screening mammograms start at age 40. In 2009, the United States Preventative Services Task Force actually put out guidelines that wanted us to start mammograms at 50 and do it every 2 years. But the American Cancer Society has not followed those guidelines and has stayed with the traditional guidelines of mammogram yearly after age 40. It's very important. It's probably the best way to detect breast cancers early. Some other things that people can do is watch their nutrition, watch their diet, exercise, alcohol consumption, and reduce in alcohol consumption has certainly been shown to be a risk factor for developing breast cancer.
So some of these things you need to watch. You've got an event coming up in honor of trying to raise awareness and money for research.
Yeah, the Perfect Pink Party. It's going to be here at the Superdome on the turf on Friday, October the 5th at 6 o'clock. And there's going to be dinner, cocktails, and a live auction there. And the funds will go to the Tom and Gail Benson Cancer Center.
I love it. The Perfect Pink Party on the turf. That sounds exciting. And of course, being that it's here, it's going to be great food. And how important are events like this when it comes to research?
Well, certainly fundraising is a very big component of us getting funds to continue to stay ahead of the game, provide up-to-date cancer care in terms of digital mammography, radiation treatment facilities, and a lot of this philanthropy monies go to enhancing patient care.
So lastly, once again, the event is taking place, and one more time?
On Friday, October the 5th at 6 o'clock here at the Superdome.
Okay, well, we hope it's a good turnout, because it seems like all of us have some connection to someone who's been touched by breast cancer.
That's right. 1 out of 8 women will be touched by breast cancer, so pretty much everybody has or knows someone touched by breast cancer.
Okay, thank you so much, Dr. Corsetti, for coming in this morning.
You're welcome. Thank you for having me.
Thanks.